and then a hospital meeting I had to attend. So I didn't get to do my live at 7 o'clock like I was hoping to. And after taking care of some stuff at home and grabbing a bite to eat with my family, it's now 10 o'clock. But I promised you I'd jump on here, so I'm on here. So my name is Dr. Adam Nally. I'm a board-certified family physician and a board-certified obesity medicine specialist. I work in Surprise, Arizona, which is a suburb of Northwest Phoenix. I've been in practice about 20 years. I do full spectrum family medicine and obesity medicine. And thought I'd come tonight. I've had lots of people very concerned about viral infections, specifically the coronavirus, and what to do. So I figured tonight, just do a little reinforcing about what can you do to prevent a viral infection. And so I've written a whole page on coronavirus, hoping people understand the truth about it. If you go to docmuscles.com, which is my website, you can see, you click on the coronavirus link, there's a whole page about coronavirus, and I try to keep it updated with all the new stuff that's coming out regularly. So it gets updated every day or two when I can. The second thing I was going to point out was that tonight I thought I would talk about just a couple things in regards to what can be done to help avoid infections and avoid this infection and other infections. There are about 8 or 10 different viral infections that are out there, and I've had a lot of patients tell me, Doctor, they're convinced they had the coronavirus in January or December. And I can tell you that you probably did not have it. The most common presenting symptom with this particular infection that occurs in 90 to 95% of the people that have had it around the world since it came out initially in January is a fever of over 101 that usually occurs in 95% of the patients. Second most common issue is a dry cough without any sinus discharge. No sore throat, just a dry cough. Third most common effect is shortness of breath. So that occurs in 70% of people. So those are the 3 most common things that happen with this particular virus. So it's important to understand that. Most of what we have seen with patients in January and February and even this month are either rhinovirus, adenovirus, parainfluenza virus, the true flu influenza virus, allergies. I'm stuffy right now because my allergies are flared up, and this is the time that my allergies just go crazy. So I'm a little nasally today. That's not coronavirus, it actually is allergies. And I see that, and that's what I've been seeing a great deal of this last couple of weeks as well. So I know it's late. I thought I'd just jump on here and talk about a couple of things just to help reinforce for people, because even though I've been doing nightly videos, I know a lot of people are really concerned. And I've had a few patients today, specifically their spouses, say, well, what do I do as I go to the grocery store to prevent me and my family from getting exposed? If someone was at the grocery store and coughed all over a box or coughed all over something, what do I do, and how do I approach it? Pardon me. Number one, what should you do? Well, the first and most important thing you can do is diligent hand washing. What does that mean? It means that whenever you come home from someplace or you touch something that's frequently touched by many people, you need to wash your hands. That means warm water and soap. It means washing your hands with soap and water, under running water for at least 20 seconds. That cleans the hands right off. That's important. That is the most effective way to cleanse this virus from it. This virus is an RNA virus. It's a strand it's a half strand of DNA, to make it simple, that's wrapped around with a fatty coating. Warm water destroys the fatty coating and it doesn't work. So that's warm or hot water is key. And so very simple, hot water and soap. If you don't have hot water and soap, then you can use a disinfectant, either 70% alcohol or a Clorox solution. If you're running out of those things in my home, we actually took some dry, half a slice of, or half a roll of paper towels, put them in a sealable container, and then did a mixture of a gallon of water and a third of a cup of Clorox mixed up and poured over it, and then you seal it. And that creates your own Clorox wipes, and it'll disinfect it and kill the virus within 10 seconds. And that 2 studies have shown that this particular virus is dead within 10 seconds when it's exposed to that cleansing equipment. So disinfection is important. Very simple technique. Second, respiratory hygiene. Cover your mouth. Now, if you're out and about, this has been the big argument, and it's starting to see today. And our president actually came out and said, wear a mask if you're out and about in crowds. You want to avoid large crowds. You want to avoid exposure to people coughing. And like I said, if you go to my website, docmuscles.com, click on the picture of me with my mask on, These are homemade masks, 3 to 4 layers, very simple. Although they will not completely protect you from all viral infections, the rate with this type of a mask, it actually decreases the incidence of infection between 10 to 40%, and it protects other people from you. So if you happen to be an asymptomatic carrier, it's going to protect them from you as well, and you from them. So that's nice. So I would recommend wearing a mask if you're going to be in a crowd or out and about. Now, if you're out on a trail and you're walking or you're exercising and you're by yourself, do you need to wear a mask? No. This is not an airborne disease. You cannot catch it from breathing over the grass. It's a droplet disease that someone has to cough or touch their hand and then share it with you. They rub their nose, they cough in their hand, they touch a doorknob, then you go touch it. We know that this virus and corona-like viruses can exist on surfaces up to 9 days. So that's where cleaning your surfaces and washing your hands is so important. In most cases, the virus was viable at 6 days, but in a few cases, in a few studies, the virus was present up to 9 days. So on a solid surface, a piece of plastic, something like that. So when you go to the grocery store, wear a mask, number one. Number two, while you're out and about, if you have to pick up a box or there's things that you worry that, hey, maybe someone else may have touched this box and coughed on it, don't touch your face. Now, remember, your hand and your skin is designed to protect you from viruses entering your skin. So if you touch a box that someone had coughed on, you cannot catch it by touching it unless your skin is broken open and you have an open wound. So in those cases, you want to cover it with a bandage or wear a glove. That's one legitimate reason to wear a glove, because when you touch it, it may be on your hand, but you can't get into your body until you touch an open surface of your face, your eye, your nose, your mouth. So that's why if you're out and about, don't touch your face. Now, the challenge is if your allergies are up and your nose itches, and whenever I come on lives, my nose starts to itch like crazy, and so you also want to itch your nose or touch your face. The average person touches their face between 3 and 5 times every minute, and so you have to consciously say, I'm not going to touch my face while I'm out and about. And then as soon as you finish doing your shopping, then you want to wash your hands or cleanse them with a cleaner. When you walk into the grocery store or any facility that you're going into, if there's a surface that you're going to touch frequently, scrub it off, wipe it off with a wipe, or if you have to touch it, then pull out your wipes and wipe your hands off. Very simple things to do to keep your face and your mouth clear from a viral infection. So avoid touching your face. Don't touch your face. Important aspect. Next one is if you can, avoid crowds and avoid areas that may have poor ventilation. We're all going to have to go to the grocery store and get some food. It's a given. You're going to have to go to the store to get gasoline. You're going to have to go do some things that are going to take you out of your home or away from your area where you're sheltering in place or whatever you may be doing, and you're going to be exposed to other people. The biggest thing is don't be afraid. Wear your mask. Don't touch your face. Wash your hands regularly. But if you had a choice between going here or there, and there's a large crowd there, avoid the crowd for a week or two. Not a big deal. Now, we're trying to do physical distancing. They use the term social distancing. I hate that because that implies that we have to seclude ourselves both mentally and emotionally and physically, and that's not the case. We're separating ourselves physically, but you and I are socially interacting right now, or at least I'm talking and you're listening, or you're going la 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 la. Anyway, the important point is that we want to physically distance. But if there are those around you, we don't want to fully socially distance or emotionally distance. So if you have grandparents or there's a neighbor or the lady down the street who's lost her husband, who's alone, call her up, say hello, text her, do something. You want to avoid people within about 6 to 10 feet because that's the distance where if that person coughs or they breathe, that droplet can be inhaled or enter your body. So we know that the droplets drop off by usually 6 feet and in some cases 10. So if you're keeping that distance, you're probably fine. And you're cleaning your hands, not a big deal. It's not too worrying. All right. Lastly, disinfect things and I kind of mentioned this already, but use a disinfectant of some sort. Soap and water works wonderfully well. 70% alcohol works wonderfully well. A Clorox solution works wonderfully well. Those are all things that you can do. So those are 5 things to really just keep yourself safe and protected so that you're not having any problems. And I'm sure there are hundreds of questions out there. So I'm going to roll onto the chat bar here and see who's here and see if there's any questions. Hello, guys. Thanks for joining in with us. I appreciate it. It's wonderful. So we've got people here from Missouri and LJ. Hey, LJ, how are you? West Virginia. Awesome. Wyoming. Hey, Mark, how are you? Fantastic. Let's see. Hello again from Okinawa. Konbanwa. Genki desu ka? Making masks here today. Thanks for the fusible interfacing tip. Tell your wife thank you. I will tell her, Allison. Thank you very much. I appreciate that. Hello from Congress. Hey, Karen, how are you? How's it up the mountain there? Hope all is well there up on the top of the table, I guess that you would call it here in Arizona. Hello from Oklahoma. Hey, Kat, how are you? Good evening in Michigan. Hey, Crystal, in Michigan, did they finally allow doctors to start using Plaquenil there, or is that still restricted? I hadn't seen yet. Hey, Paula, how are you from Wyoming? Good to see you. There's Tammy in Dallas. Terry says, I'm so funny. Hey, Dr. Boz, how are you? It's good to see you. I hope all is well in your neck of the woods. Let's see, recently switched to 80-20 fat protein ratio. Now, is that by calorie, Karen, I'm assuming? Can too much fat be unhealthy? Well, it's not that it's unhealthy, Karen. It's that, so think about it this way. You're eating your ketogenic diet. And remember, the whole point of metabolic syndrome is that the fat cells are overstuffed. And when fat cells get overstuffed, they overproduce hormone. We know that our fat cells are literally the largest endocrine glands in our body. They produce roughly 170 known hormones that we're aware of, and maybe more. And if the fat cell is overstuffed, it actually overproduces. So our goal is to, and then one of the reasons insulin resistance lingers for a while is that it takes a while for those fat cells to shrink. And as the fat cells shrink, they can heal. And that hormone level that they're overproducing begins to improve. So if you're eating excessive amounts of fat and you become fat adapted, so within the first 3 months, usually you can get away with tons of fat and not have a problem and you'll lose weight. But by the third month, most people are completely fat adapted, which means that you become a really efficient fat absorber. And that means you're absorbing fat effectively in through the gut, into the bloodstream immediately. If that fat, that cholesterol, and that triglyceride is in the bloodstream, the body begins to cycle it through the blood, through the liver, and through the fat cells. There's constantly fat moving through the fat cell. It's like a coin purse. You have a big purse and you have a smaller coin purse, and the body's constantly cycling that fat through. Well, if you have a larger amount of fat in a bloodstream, your body's going to probably use that up initially before it cycles it into that fat cell, and that fat cell will probably stay bigger longer. So one of the keys is that we want to eat enough fat to be full, but not enough fat that we're not letting the fat cells shrink. And that's one of the things I find after the third month with a lot of people is that if they're pushing 90% fat or 80% fat, that oftentimes slows the weight loss. Now, the wiggle room is those that are exercising heavily. If you're working out an hour a day, 6 days a week, usually that's enough that you're burning through those calories and it's not a big deal. So that's where exercise becomes a wonderful wiggle room, if that makes sense. But for those that can't exercise, and I have a lot of patients that are wheelchair bound or things like that, initially we can do 70, 80% fat by calorie. But what I usually tell people is do a 1-to-1 ratio of protein to fat. That puts you pretty much usually at 70% fat and 30% protein. That's a ratio that seems to work really well for most people pretty consistently. And then once those fat cells get smaller and smaller and you've got that last 20 pounds, sometimes we have to bring that fat down to 60% or even 50% and bring the protein up to maintain the calories and the muscle mass. And so I've talked about this on and off with a few people, and I've given a couple lectures on this, on how that cycle occurs. And the bodybuilders are all saying, oh, you got to go high protein and low fat. Well, remember, they have tons of muscle. Their fat cells have shrunken down. And for them to tone up, they do bring that fat down. But a lot of them are still doing high fat. Remember, the definition of a high fat diet is any diet where the calories from fat are over 30% fat. So you have this wiggle room somewhere between 70 and 30% fat. That's still a high fat diet, but you're just bringing that fat content down. So if you're doing 80% fat and 20% protein, initially in the first 3 months, you'll probably see success. But you may see some slowing. So what I tell people is bring that down. Now, how do you pick 1-to-1 by grams? You pick 1-to-1 by grams by essentially picking foods that are born that way or made that way. The good Lord, when he made red meat, pork, eggs, bacon, they're all pretty much 1-to-1. An egg is 7 grams of protein and 7 grams of fat. Red meat is roughly 1-to-1, depending on the cut, maybe a little higher on the fat, maybe a little lower on the fat. Pork is the same way. Now, chicken, fish, and turkey, they're much lower in fat. And in those cases, you may want to add a bit of fat, cook them in butter, things like that. But slathering everything in fat to push the calories up is usually not effective after the third month, to be frank. So that was a long-winded answer, but hopefully that helps. If you're drinking your calories, meaning you're loading your coffee full of fat, it'll be great for the first 3 months, but after that third month, you probably will have trouble. That was a long-winded answer. I'm going to go back and see if okay. So hopefully, Karen, hopefully that answers the question for you. Hello from Washington. Hey, Anna Marie. And there's Deborah from Alabama, and Gwen is playing in the snow in Vail. Oh, exciting. Great reminder, says Bobby. Oh, you're welcome, Bobby. I hope that's helpful with people in regards to just don't worry, don't stress. If you're stressing, that's lowering your immune system. So we don't want to stress, but just do some basic hygiene. Sometimes we wonder, people have forgotten how to wash their hands. And when you start teaching people how to rewash their hands, we now realize, why we were having to tell people not to eat Tide Pods. Because but simple common sense, which I realize isn't always common, but important. Hey, Michael, let's see. Leaving non-perishables in the garage to quarantine and then wiping them off, which is perfect. And I meant to go and get to that. So let's say you're bringing home groceries. Last night, one of my viewers, and I can't remember who it was, said they bring the groceries home and they set the bags on the floor. And then as they pick them up, they just take wipes and wipe them down. Perfect. 10 seconds, the virus is gone. Nothing to worry about. That's great. So if you can wipe them down, or if it's vegetables, wash them off, just rinse them off, and a little bit of friction with your hands under the water, the virus is gone. Not a big deal. So some good things to look at there. Hello from St. Louis, and Linda's in Texas. Marilyn is in Missouri. Let's see. Hello in Livermore, California. Hey, Denise, how are you? And then there's Winnette in Dubois, Pennsylvania. Am I saying that right? I said that wrong last time. Southern California. Hey, Lisa. Let's see. San Diego, no beaches to walk on. That's terrible, Lori. I'm sure the boardwalks are probably busy with lots of people, so you probably want to avoid those too, or they may be closed. I don't know. We're at the Lost Dutchman's Mine in Stanton Camp. Oh, wow. Cool. Very nice looking. Oh, that's awesome. Hello, Liz in Chino Hills. And let's see. There's Shelly in Maine. Karen says she's tracking the grams. Perfect. All right. Sleep schedule is way off from not working. I get it. I get it. But the keeping that schedule though is actually really important for a lot of people. So that's the ratio I like. And yes, even 60% sometimes, says Paula. And it works. So that's what I find is, for the first 3 months, and initially when we started doing ketogenic diets 16 years ago, we initially thought, hey, you can have all the fat you want, because people did really, really well for the first 3 months. And then there was this slowing that occurred. And then people said, oh, it must be the calories. You got to go back to calories. And it's not calories. It's still hormonal. But remember, you're more efficient at absorbing fat. And if you understand how fat is cycled through the system, you start to recognize that the hormones still play a huge role. And that cycling is really what's key. And as you become you become more fat adapted or more adept at absorbing fat, then that's what seems to happen. Vitamin C and zinc for kids is okay. Yes, it is, Michael. It's fantastic. Karen says carnivore for 4 months. Glucose is in the 130s in the morning, dropping with less protein. Was 110 this morning. So remember, Karen, that fasting sugar is elevated because you probably still have sick fat cells. And those fat cells are stimulating your body to keep the blood sugar higher. It takes up to 2 years for that to correct. So don't be discouraged by it. Don't be upset by it. That higher fasting sugar will come down over time, but it takes time, and you just have to be patient with it. Because all your other parameters, I guarantee, are going to be looking better. But the body will bring that down over time. Talked about statin drugs. What about lisinopril? Hubby just went on it. I go to a naturopath, and we're working on bringing down naturally. So it's not the salt that causes your hypertension. It's the higher insulin response. So remember, insulin stimulates your body to hang on to salt. And when the insulin's up, your body holds more salt and the blood pressure goes up. And we've told people for years, restrict the salt. Well, if you cut out salt, I guarantee your blood pressure will drop by a whopping 5 points. That's it. Most of us who have hypertension need to see that blood pressure drop by 20 or 30 points. So cutting out salt doesn't do anything for you. But as soon as you cut out the sugar and you stop eating your ice cream bars, and your cookies, all of a sudden within literally a week, you'll see that blood pressure normalize, because now insulin is dropped to normal, and your salt intake starts to drop. And so all of a sudden your blood pressure drops. Lisinopril is a great drug. I think it's a fantastic drug for blood pressure, and it's probably one of the safest in regards to all of the blood pressure classes and their side effects. And it actually is protective for the kidney. So I like lisinopril a lot. It's getting a bad rap because those with severe problems with coronavirus, when they hit the severity, sometimes that lisinopril can amplify the effect of the virus in the lung. But I wouldn't worry about it unless you are one of those sick people in the hospital, and then the doctor's probably going to stop it. So don't worry too much about it. But from the perspective of blood pressure, it's great. Now, if you can control your diet within a few weeks, and there's some people who are a little more resistant, a few months, I'm able usually to wean those blood pressure pills like lisinopril off without a problem. But work with your doctor on that, because it's important that you're bringing it down in a normal way. Thank you for the fat to protein explanation. Oh, good, Bobby. I've tried to give that with a couple of these lives I do, and hopefully it helps. All right, Nita from Wichita Falls, Texas. Awesome. I work in the food service. You'd be surprised how many people don't know how to wash their hands. I'm amazed at how many people don't wash their hands. As a physician who has to wash his hands between every single patient I see, and you walk into a public facility and you walk into the restroom, and the number of people you see leave the bathroom without washing their hands blows me away. It makes you sick sometimes. Sometimes you want to go into the bathroom with the blinders on just so you don't have to see it. But then you don't want to touch the doors. That's where the handy wipes come in. All right. Hello from Florida. Kathy, I heard that they just closed the borders in Florida. Is that true? If you don't have a Florida driver's license or ID, apparently they're not letting you in. I was told. I don't know if that's true or not. Maybe you can verify that for me. Still correcting the fasting sugar, but battling poor sleep. But if the sleep is, hopefully, Mark, the sleep will improve. And as it does, you'll do better. Any advice for diarrhea on keto? So Karen, if you're having diarrhea on keto, that means you're taking in too much fat for your body to absorb. One of the most common side effects of excessive fat in the diet is diarrhea. So back the fat off a little bit. The other could be there's something you're eating or a supplement you're using that has too much magnesium in it. So back the magnesium off a little bit and back the fat off, and the diarrhea should improve. That's usually means you're taking in too much fat. You haven't fully fat adapted. Or if I guarantee if I eat a really fatty meal and I overload the fat and I do 90% fat, loose bowels are in the next 24 hours. And I see that with most of my patients. If insulin resistance, is it okay to take elderberries for immune system? Linda, elderberry does raise the immune response, but in this particular virus with coronavirus, there's been 2 studies that I've seen that actually showed it to be worse. So I don't recommend elderberries currently. Don't fully understand what the mechanism behind it is, but in both of those cases, they show that elderberry actually made it worse. So I don't recommend elderberries currently with this particular virus. And it may just be the way this virus replicates. We don't know. Florida on stay-at-home mandate now, says Jolanda. Okay, thank you. Hello in Virginia Beach. It's Macy. And do I think supplements are important during keto? Of course I do. I design my own vitamin because of it. I personally use Berberine every day because I am one of those highly insulin resistant people. So I take Berberine every morning and every night with a meal. I designed my own vitamin called the Keto Essentials vitamin, and you can find it at ketoliving.com. I use it every day myself. I was somewhat selfish because I couldn't find a vitamin that I liked for the insulin resistant pre-diabetic diabetic patient that had what I wanted in it. And so a couple of years ago, designed my own. You can find them at ketoliving.com. Let's see here. Today, heard Dr. Berkowitz recommend taking quercetin 500 to 1,000 milligrams 1 time per day to prevent COVID. I have not seen that recommendation yet, but I've got to look at it and take a peek. I wouldn't be surprised. It does help to some degree, but I would like to see the data on it before I start recommending it to everybody. Because I would like to know what the mechanism is, so we know why we're recommending it. Let's see. Get buses of people from Pennsylvania gets buses of people from New York to shop, trying to get them to stop. Oh, okay. No borders. No, the borders are not closed in Florida. Oh, okay, that's good to know. How much melatonin do I recommend? I recommend between 5 and 10 milligrams nightly, Mandy. That's what I recommend. The interesting thing and the reason for this is that they actually showed that kids and pregnant women don't seem to have the severity of when this virus attacks. And they noticed that the one difference is that their melatonin is between 5 and 10 times higher. And so that is one of the protocols is melatonin with the patients that are sick. And it can be used prophylactically, and melatonin makes your skin wonderful and it helps you sleep good. So there's 3 or 4 reasons you can use melatonin. So hopefully that helps. Good questions, you guys. Hopefully, you guys are up late. And some of you are in New York. That means it's like 1 o'clock in the morning. Do you ever sleep there? All right. Ordered my vitamins yesterday. Oh, thank you, Julia. I'm curious to know how you feel with them and how they work. Let me know. I would like to know. I really would. All right. Let's see. Did I miss any questions up here? I'm going to check and see. All right. I I think I got them. All right. Well, it is late, you guys. We've been chatting for 25 minutes here. Hopefully this format is helpful. I usually will roll this over to YouTube here after it loads up, and that way it's available to see on YouTube. Haven't been watching much news. I'm so over this Corona thing, says Kathy Stringham. I totally understand. The problem is the news just repeats the same crap over and over again, and half the time it's wrong or it's misleading. And so I personally am just watching the primary sources that I can find that actually give real up-to-date information that's legitimate. Should I give my kids melatonin during this? Mandy, I can't tell you if you should or shouldn't, but I can tell you I give it to my kids. Now my kids are adult teens, or they're in the upper limit of their teens. For younger kids, I would use a lower dose, like 1 milligram to 5 milligrams. If I had younger kids. Do you work with Hashimoto's? Every single day, Linda. I do every single day. Let's see. I feel groggy in the morning with melatonin. Jane, then you're probably not getting enough sleep. And melatonin, remember, melatonin spikes and it actually turns on the sleep cycle. And so it stimulates that. And if the melatonin makes you too sleepy, my suggestion would be back the dose down a little bit, cut it in half, and see how that works. But if you're really groggy, you may actually need more recovery sleep, or you're not recovering well because your female hormones are off, which is another issue. So if your progesterone and pregnenolone are off, that can be a factor as well. How much berberine? I start, Mark, with 500 milligrams twice a day with the 2 meals. So either breakfast or lunch and then dinner. And they actually showed there are a couple studies that showed berberine 500 milligrams outperformed metformin in regards to weight loss and glucose control at the same dosage, 500 milligrams a day, and it was more effective with weight loss. Very helpful. Oh, good. I'm glad to hear that, Macy. Thank you. Do you have a melatonin supplement brand that I recommend? Deborah, I don't. We use the brand. I think my wife got it from, I think it's the Kirkland brand. I have to look at, or no, it's Nature's Plus is the brand that we have, I think. And it seems to work really well. I don't have a specific melatonin brand, but I probably should, huh? I have not made one yet. Is my office open? Absolutely, it's open. Now, about 50% of the patients we're doing telemedicine right now because they're non-urgent, but those that are urgent, there are some things I just have to physically see. And so, yes, we're still open and I'm still seeing patients. My PA is doing most of his, actually last couple of days, I think all of his visits have been telemedicine visits. And then 50% of mine have been telemedicine, and then I did that as well. Can you sing us to sleep? Kathy, do you want to hear like a dog howl? That's what it would probably sound like if I sung you to sleep. You don't want to hear me sing. I can hit a few notes on key, but many of them may not be. And you may have nightmares. So I would hesitate to do that. Do your vitamins work with Hashimoto's? Absolutely they do. Yes, Linda. They're designed to help stabilize the components of prediabetes, thyroid, and leptin, and the metabolism. How do you feel about monolaurin? Lindsay, I have not looked at monolaurin at all. I need to look at it. I can't even comment on that because I haven't looked a lot at it. Extremely helpful, so thank you. Oh, you're very welcome, Karen. 124 in Columbus, Georgia. I take melatonin every night. Well, Betty, apparently your melatonin's not working. If it's 124 in the morning, well, maybe your morning is 2:00 in the morning when you take your melatonin. If you already took your melatonin and it's 124 in the morning, you're either really jazzed about watching me or it's not working. So we need to talk about some other approach for you. Why are you recommending taking the melatonin? Michelle, they showed in a couple of studies, these are small case studies, but we know that stabilizing the melatonin cycle and having adequate zinc diminishes the ability of the virus to replicate. And there's a couple suspected ways that that's happening. We don't fully understand it, but we know that those with a higher melatonin level have a less severe response to the virus. And when zinc is low, those that have the most severe cases have low levels of zinc and their sleep cycle's off, meaning the melatonin is low. So they're finding that when we supplement melatonin and zinc with the protocols that they're using, that actually does help a great deal in the healing process. So that's what I'm recommending or having patients consider. Can't give you any medical advice on here. I'm just telling you educationally something to consider for you. I hate having Hashi. Well, then stop having it. Fix your diet, go keto. And if that does not solve it, then there are some thyroiditis protocols that I use in my practice to help patients stabilize their thyroid. And I talked about those in my YouTube video on thyroid when I did the Keto Salt Lake. So go to youtube.com/Dr. Nally and check out the thyroid video. And we talk about some of the protocols for diminishing thyroiditis. You can start with 500 a day with the highest carb meal and work towards twice a day. What are you referring to, Paula? I'm not sure what are you referring to? Is that, are you talking about Berberine? Usually I'll start with 1 a day and I'll go to then 2 a day. If you're not horribly insulin resistant, 1 a day works. If you're referring to Berberine, I'm assuming that's what you're referring to. I get leg cramps bad. I take electrolyte supplements, but it doesn't work. So Rochelle, and I hope I'm saying that right, leg cramps are driven by 7 things. Number 1, fluctuations in blood sugar. If your blood sugars are off, the leg cramps won't go away. So cut out the carbs. If there's garbage in your life, you need to take it out. Take it out with the trash. Number 2, if your thyroid's off, you're going to have leg cramps. Number 3, sodium and potassium cause cramps during the daytime. Magnesium and zinc cause cramps at the nighttime. And then lastly, if you're dehydrated, you can get leg cramps. If you're overworking your muscles and you're not stretching them out, you can get leg cramps. And then really severe varicose veins, that's actually 9, can cause leg cramps. So those are the most common causes of leg cramps. And if any of those have not been addressed in your life, then you may want to look in the mirror and address them. All right, Kathy, let's see. I wash my hands a lot, but when will it be okay to shower? Alec, somebody, Tim actually asked that question yesterday. And for some of you, I said it's okay to start showering now. In fact, you should start showering now. And for a few of them, just keep washing your hands. There's a pretty good one at CVS. I think it's called Radiance. Is that you're referring to a melatonin? Is that what you're referring to, Paula? I'm not sure what you're referring to. All right, Mark and Paula have a conversation there. Helpful information. Look forward to hearing me every night. Thank you, Heather. That's kind of you. I called your office and they said we're not taking new patients. Was bummed. Well, Karen, yes. The challenge is we got overwhelmed, and in the present time frame, we're not taking any new patients. But hopefully, in the future, as we are able to level this out, all the craziness, and we get things balanced out, we'll start taking them again. What do I think about the CDC recently changing to airborne instead of droplets? They changed in the last couple of days. Actually, they changed from airborne to droplets, not droplets to airborne. This is a droplet-based virus. It's not airborne. If this was an airborne disease, they would be doing this totally different. This is a droplet-based disease, not airborne. I don't know. I think you got that flipped and backwards. I haven't seen anything that the CDC said about it being airborne. They actually changed it to droplet-based. That's why these kind of masks become much more effective. Just took it. Then I came on. You just took your melatonin, Betty, or you just took your berberine, or you just took your zinc. Can bariatric patients take my vitamins? My vitamins were designed for bariatric patients with weight loss issues who are post-bariatric surgery. Yes, you can. How much melatonin? Take 10. 1 to 10 milligrams is the recommended range. I personally take 10. That's what I do. If you're too groggy the next morning, decrease it to 5. Let's see. I am super excited and happy to get to see you for an appointment next week. Oh, cool, Sarah. Awesome. Scheduling my appointment was the highlight of your week. Oh, how exciting. Well, we look forward to seeing you. That's awesome, Sarah. We look forward to having you in the office. I find that melatonin works better for me if I take magnesium with it. Magnesium has a sedative effect to some people as well, Joan. So yes, and it actually has a muscle relaxant effect as well. Does melatonin or zinc affect warfarin? They can. Magnesium and zinc can affect it. So you want to watch your warfarin or your Coumadin dose, your PTINR closely. If you're adding those on board, I would be checking them. I would be checking your levels every 3 days or so for the first couple weeks. Someone asked about berberine. Oh, and you were answering. Thank you, Paula. Missed the beginning of the live. Vitamin D and C to fight viral infections. Well, vitamin D is essential in everything. So if you're deficient in vitamin D, I highly recommend supplementing if you need it. Vitamin C is great in regards to the short term. Vitamin C is great generally, Raymond, But I know people mega dose it, and all I've seen in regards to research is that it just creates really expensive urine if you do too much, and too much vitamin D just makes really expensive stool. So if you like golden stool and platinum urine, you can do excessive amounts of it, but I don't think it's worth it. But using about 150 or 1,500 milligrams of vitamin C per day, and somewhere between, depending on what you need vitamin D wise, somewhere between 1,000 and 5,000 a day of vitamin D is the usual recommended dose. Washing your face and hands often, that's awesome. Good. All right. What are my thoughts on people using essential oil inhalers? All right. Okay. Well, Mandy, some of you are going to be offended and you won't like me anymore. If you vape, my suggestion to you is good luck with your popcorn lungs, because you will get them. Vaping is the worst thing that you could do in your entire life. It is worse than smoking. We have multiple people here in Arizona that vape and end up having to be on ventilators and have to have chest tubes because they create popcorn lungs. Worst thing I've ever seen. I don't think that vaping is good at all, and I would highly caution you against even considering it. And if my kids considered it, I would slap them upside the head and tell them to I would actually probably take them down and let them see what popcorn lung looked like. Second, essential oils. In my perspective, and I'm going to offend all the essential oil people out there, so I'm sorry. If you love your essential oils, take your fingers, put them in your ears for just a moment, and I'm going to say the only essential oil that I think is essential is bacon grease. Sorry. And if you're vaping bacon grease, you're going to be even worse off. I do not recommend that at all. But I use bacon grease to cook with, but I do not recommend vaping of any sort. All right, CDC changed it back to airborne. I have not seen that, and I've been watching the CDC site closely. So Jenny, if that's true, I missed it. But that I literally look at the CDC site every day, and I watch my sites, and I have not seen that. So I need to go look, but I that's not what I've been seeing from anyone in the last 48 hours. So I will check that again. How long is the droplet in the air? So the droplet will only remain in the air for 6 to 10 feet, and then it falls because it's a droplet. It's not aerosolized. Now there was a study where they actually aerosolized the virus, but you have to have an aerosolizer to do that. Your lungs don't aerosolize it. They create it in a droplet. All right, I have bronchitis. This is my doc. Antibiotics and prednisone, anything asthmatic can do to ensure you don't catch the virus. Wash your hands, use a mask, take your medication. Be careful with your exposures, things like that. And those are really the best things you can do. If you're currently sick, my suggestion is quarantine yourself even closely and more tighter. Made 11 masks today out of sewing supplies. Awesome, Nisha. That's awesome. Is it okay to take supplement recommendations with just one kidney? Yeah, I have multiple patients with just a single kidney, and they do wonderfully well with that. Let's see here. Does zinc help with absorption of Plaquenil and with treatment for COVID? I have not seen any study in regards to whether zinc changes the Plaquenil absorption. That I don't know that answer, Tammy. That's a good question. Bacon grease, yes. Let's see. News Today is reporting it spreads by just breathing. Yeah, Karen, it's a droplet-based spread, person to person, usually within contact of about 10 feet, because it's a droplet. And then, like I said, initially the World Health Organization and the CDC thought it was aerosolized, and they argued about it for a while because there was a study that came out saying that when it was aerosolized, it could stay in the air for about 30 minutes. But when you cough, even if you cough or sneeze, it's not aerosolized. It's still droplet based. Now, if you cough and sneeze into a fan or an air conditioner, then you could probably aerosolize it. Don't recommend doing that. And if you intentionally did that, we know that there are now laws that say if you intentionally expose people to this virus and you have it, it is a federal offense, and you can serve prison time for that, because that is so if you're intentionally exposing people to coronavirus through exposures, that is now a prosecutable offense. The whole vape thing with essential oils sounded like the dumbest thing ever. Eating Tide Pods sounds to me like the dumbest thing ever, but people still do it. So and I'm not condoning that at all, nor am I condoning vaping. I really don't. I mean, if you vape an essential oil, you're going to kill your lungs, and that's what happens. If people are vaping these essential oils, and they're destroying their lungs. Just vaping in general creates popcorn lung, and it is really not something you ever want to have. Can our pets get coronavirus? They actually studied this, and cats cannot. One of the things that they thought was that this virus was actually being transmitted through feline live cultures. The market in Wuhan, China, is a live wild animal market. So people go there to buy live animals to cook and eat. And cats are one of the delicacies that are there. Dogs are, and they found that this was not transmissible through cats and dogs. It is transmissible through bats. And as I understand it, they do sell live bats in that market. So, as I understand some of the data that's public knowledge right now is that they were actually looking at some of the bats that were in that market there, and so they shut the market down and sterilized the whole area. But it's a wild animal market, so people catch wild animals, bring them in, and sell them for food. If I understand correctly what was happening, that's what the stories that I'd read, the reports that I read were talking about. And one of the main researchers that was researching SARS viruses in regards to this, who was really a world expert in SARS viruses, worked in a facility that was 900 feet away from this market, and that's where we suspect patient 0 started. How it got there, don't know yet, but that's what the public records have shown. If you walk where someone coughed 30 minutes ago, is it gone? As far as we know, it is, Deborah. Yes. So just walking into their space, their airspace doesn't cause it. Now, if they coughed on the doorknob and that virus hit the surface, a hard surface, plastic surface, steel surface, and you walk up and you touch that surface, then you still could, and then you touch your face after you touch the door, you could pick it up that way. But if someone coughs and it hits the dirt, unless you're down licking the dirt, you're probably fine. I don't recommend licking the dirt. Is it recommended to continue using CPAP during viral illnesses? Yes, Michael, I highly recommend continuing the CPAP, but I recommend cleaning your CPAP machine regularly. So it's not a big deal. You're sterilizing your CPAP, changing out your filters, all that sort of stuff, changing out your water supply with your humidifier. Bacon beats bugs. It does, yes. I like that hashtag. That's good. How do we sterilize our cloth masks? You take this and you put it in the washer with soap and you wash it. And then you put it in the dryer and dry it, and it's clean. Or if you don't have a washer, you actually rinse it with soap and warm water and soap, and then let it air dry. Works perfect. I had to do some cultures today on some patients, so I had another mask that I actually double masked with. I had my regular surgical mask, and then I double masked this over the top of it because I am out of the N95 masks in my office. And so then came home, stripped down, everything went in the washer, and it's been washed with hot water and soap. And so they work really well that way. Should you not go to work or anywhere with any fever? So let me put it this way. If you have a fever over 100, my suggestion is stay home, get better. And if your fever is not getting better or you're getting worse, you need to call your doctor. If you have a fever of 103, do not go to work. I will not let people into my office if they have a fever over 100. So our screening protocol right now is if you walk up to my doors, there's a sign on the door that says, if you have a fever over 100, a dry cough or body aches or combination of those three, call my office first before you walk through the doors, because we will not let you in the office. We have a special protocol to treat you if that's the case. If you have a fever over 100, my suggestion is stay home. Again, that's the protocol the CDC is asking, and most states are enacting. If you've got a fever, stay home and get better. I missed the start, going to watch the replay. You are very welcome. Hello, Kathy. We've been going on for a while here answering these really good questions. I think I've heard so many different things, not sure what to believe. Oh, you're very welcome, Kathy. Hopefully this is clear. It needs to be, I think one of the things is that so many people are hearing so many different things. Do the basics. That's really it. If you're doing the basics, you should be fine. We know pretty much what we need to know about this virus to be safe. Now what we've asked people to do is to try to use it. And I realize there are still people out there that think I'm full of crap. And that's okay. They can think that if they want to. But I know 4 people personally that 3 of them have passed away, and one of them's on a ventilator right now. So I'm taking this seriously. I've never seen influenza. In 20 years of medical practice, I've never seen influenza do that. And I realize the influenza death numbers are higher right now, but I have never seen influenza do this to people. Never. This is a more severe illness than influenza. Now the numbers, the effective numbers, we still don't know because it's hitting each population slightly differently because of the health of that population and their proximity to each other. That's why it's slightly different. But if you get the illness, the rapidity with which it kicks in and the severity is dramatically worse than influenza. When I find when I'm on keto, I have a weaker urine stream, and I'm just going crazy. Is there actually science behind it? A weaker urine stream? Rachel, you're probably not taking enough salt. What most people don't do is I take in literally 3 to 4 teaspoons of salt, pink salt, every day. If you're not drinking enough salt, see, when you're on keto, you start dumping salt, and water follows salt out. And then if you're salt depleted, your urine stream gets weak. And so even if you're drinking water, remember your kidney gets rid of the body water by putting salts, sodium, potassium, magnesium, and zinc into your kidney. And then the water follows it in and you pee it out. If you don't have the salt to put in your kidney, your stream's going to be weak. Let's see here. Do we think we will flatten the curve the next 2 to 4 weeks? I sure hope so. And if you look at some of the other countries that have enacted what we've done, a lot of the Asian countries who've been very vigilant about watching their temperatures, very vigilant about social distancing or physical distancing, very vigilant about wearing masks, they've actually started to make the curve occur. It's Czechia. They started wearing masks. They mandated mask wearing everywhere, but their government mandated it, and they're all of a sudden bending the curve. So yes, I think we can bend the curve if we do it. But the challenge is in the United States, where it's a free country and people are free to do what they want to do, and we make a recommendation. A lot of people go, "No, that's not for me. I'm fine." That's the hard part. Do we take away your freedoms and mandate this, or do we let people have their freedoms and give recommendations? We live in a country that has freedoms, and one concern is, we want to protect people from their health, but they also have their freedom to choose. And that when we start mandating and take away freedoms to choose, we start becoming dictatorial, and that's a whole political side that we won't go there. But think about it. Think about what happens if if you like your freedom to say, someone gives you advice, do I take the advice or not? That's part of one of the reasons we have liberty here in the United States. And so if someone says, well, you have to do it, and like in China, they said you have to be in your home, and people wouldn't, so they went and welded them into their homes. That's kind of dictatorial, and I don't think that you live in the United States for that reason. So some things we have to think about, and we still have to give people their agency to choose. So some important ethical things that are coming up with this. Is it antibacterial or just vinegar to kill a virus? Vinegar does not kill it. It has to be bactericidal, not bacteriostatic, Raymond. So hopefully you know the difference between that. Bacteriostatic means it stuns it. It's like a stun gun. It moves so bacteriostatic is what most hand sanitizers do because the alcohol content is not high enough. And it stuns the bacteria, so it moves from here to here. Didn't kill it, it just stuns it. So it needs to be bactericidal, not bacteriostatic. And vinegar doesn't do it unless it's highly concentrated. Let's see where I'm at. Let's see, you look like I need sleep. I do need sleep, Lisa. I need to go to bed. I am exhausted, so I need to go to bed. But I promised everyone I would do a live. So can you see the circles under my eyes? Yes, I need to go to sleep. I've been up. I really had a 14-hour day today, and I still didn't finish my charts. But I wanted to give you guys some good information. That way you would be prepared for Friday and the weekend. Do I think takeout is too risky? That's a question, and you kind of wonder. Is that food worker? Did they wash their hands? Do they have a fever and they didn't tell anybody? That's one of those things you kind of got to play your. You got to decide on that. Hair loss on keto. That's a whole other topic. Is it McChris? That's usually due to lack of protein, not enough fat, or a vitamin deficiency, or progesterone or pregnenolone is too low. So those are hormone issues. All right. Excuse me. Allergies are kicking in again. We'll watch again. All right. Is there a major lung damage post? Excuse me. Throat just got dry. Is there a major lung damage post-corona recovery? I've not seen that, but there might be. I've not seen any studies on that. All right, guys. Excuse me. I got to go get some water because I've been talking for 50 minutes straight, and I got to take some medicine for my sinuses because my allergies are flaring up on me. You guys have a great night. If your immune system is low, is that why people are more likely to get this virus? Well, that's one reason. The other reason is that metabolic syndrome or insulin resistance has some significant effect on the cytokines, which also has a problem with this particular. And I talked about that in a couple of other videos last night and the night before. And I actually wrote about it on the coronavirus page. So go check that out. Yes, freedoms are important. You guys are very welcome. Have a great night, guys. I am going to go get some water before I start coughing and hacking, and you all think that I have the plague. And I'm going to go take a nap. Need to go get some sleep and get a nap. So you guys have a great evening, and we'll see you tomorrow. I usually try to come on sometime between 7 and 8, but it's been more like 8 and 9, and tonight it was 10. So I apologize, but anyway, thanks for you guys who joined in. I'm going to roll this over to YouTube after it loads up, either later tonight or first thing in the morning. And you guys have a great evening. And remember, keep the fat high, keep the carbs low, pass the bacon, and wear your mask. Have a good night. Take care, guys. I'll talk to you soon.